everyone. This is Dr. Shaher Khan. I'm here to talk to you in regards to scars, scar management, what's the best way to deal with scars, and what to do when you get one. I'm a board certified plastic surgeon, ASPS board certified in plastic surgery, and I'm here to shed some light on what to do when you get a scar. Scars are very interesting. They are a body's way of dealing with a stress, which is a break in the barrier of the skin such that the body starts to heal. Sometimes it overreacts and forms hypertrophic scarring. Sometimes it can lead to keloid formation. Now the goal here is when someone gets a cut, you want to assess and see how deep it goes. If it's through the superficial layers and the partial layer of the skin, we can apply a bacitracin or neosporin triple antibiotic directly on top, which will allow for the moisturizer along with the triple antibiotics to do its job and prevent any of this potential infection from forming. In the next 2 to 3 days, this will eventually close, and then you can manage it in that fashion. And as we know, these are very similar to paper cuts. However, if the cuts are extensive, which means it penetrates the superficial and the deep dermal or the skin layers, and you see fatty tissue, that means you have a full thickness cut. And in order to best manage it, you have to close it such that you close the deeper layer, followed by the intermediate layer, and then the superficial layer, so that you have a reinforced bringing together of the skin such that it doesn't dehisce. I do not like to use glues, for example. The reason being, the glue would allow for the skin to close at the surface, and inevitably over the next couple of days what would happen is it would open up and then separate, and because the lower layer was not closed, so I have never used glues to close full thickness injuries for that reason. If there are deeper injuries, they need to be assessed for any potential nerve damage or foreign bodies like gravel or other vital structures that may have been involved, such as the nerves. If that does occur, indeed you need to get attention by a board certified plastic surgeon or a hand surgeon so you can get these managed right away. So the top 10 things that I would recommend for the effective management of scars is: number 1, massage. By far the most important aspect. What it does is when you massage a laceration, what it does is it allows in massaging in this format in a circular fashion, and then going up and down if my creases the scar, and then again going with gentle pressure in a circular motion. What it does is it actually does 3 things. Number 1, it desensitizes those nerves endings that were cut, which went haywire. Number 2, it causes nerves to come in an orderly fashion towards the surface so that you have nice sensation when you pass your finger directly over the scar, so that it inevitably will settle and you will have sensation. And number 3, the collagen that lays down is in an irregular pattern or disarray, and with the massaging it helps lay it down such that you have a nice normal pattern. Number 9, no peroxide. Peroxide has been shown to clean out the wound. It is relatively effective, but what it does is it also damages the good skin, the healing skin. And so for that reason, the risks are more than the benefit. And so for that reason, it's been studied and extensively proven that the peroxide actually is detrimental, not good for the scar. So no peroxide. Scars take 1 full year up to 18 months to truly settle, depending on the nature of the scar and the depth, if it involves the nerves or not. Scratching by far is one of the worst things that you can do. You're only going to traumatize the skin even more, kind of fuel it's like throwing gasoline onto a scar, which will fuel the fire essentially. So scratching is out. You should avoid sunlight. The sun rays, UV rays, will damage a scar and cause it to get inflamed and angry and irritated. That may precipitate more of a itch that will certainly cause unavoidable scratching. So recommendation is to avoid sunlight. Number 2, it should always be moisturized by a good moisturizer, and the ones that I like, which have been proven to be good and natural, are the vitamin E, aloe vera, or olive oil. And between the three of them, you cannot go wrong as far as applying a nice thin film of oil so that the skin is well lubricated and it allows for the scar to be well moisturized. You should never allow for the wound or the scar to be under pressure or stress forces or shear forces, because what it does is it puts stress on the scar that allows for it to open up to hiss, and the collagen that's putting and bringing the skin together does not get a chance. So whenever we as plastic surgeons close a wound, we always make sure that it is under tension free, and not only that, but that post-operatively there is no stress so that the scar or the skin does not get pulled. So one of the other modalities that I like with the scars is to use a product, Care silicone sheet. And it actually is a very nice product in the sense that it is relatively thick. It is unlike the many other silicone products that you use. They come as like a one big piece that you can cut into a size of a postage stamp. And then, as you can see, it's relatively thick, and you lay it down very effectively on a C-section scar or a thyroid scar or midline, whatever scar it may be, even the back of a hand, and it sticks readily, so that what it does is if there is trauma, it will protect the skin from being traumatized. It will allow for some water therapy. It will also protect it from the UV and the regular shear forces that we go through on a daily basis hitting our hand. So this is a very effective silicone sheet, very thick, as you can see, approximately 2 millimeters. And then you can peel it on and off, and allows for a good bumper, if you will, that absorbs the shock so as to prevent any problems. What we can do in general to minimize scars or to basically allow for good natural skin health, is to make sure that we have our skin that's well moisturized. So you should not have dry skin. Number 2, you should avoid the sunlight, for the UV rays only damage and irritate the skin. As you can imagine, on a sunny day, just going outside for a couple of hours will cause the skin to get red and irritated, and you may end up even getting a partial or superficial thickness burn. Third and last but not least is alcohol, which has been shown to actually cause the patients to age more. So no consumption of alcohol actually is good for the skin as far as the elasticity of the skin is preserved. So there have been studies that have shown patients who smoke and identical twins who do not smoke. Smoking has also been shown to age the skin dramatically, so that if you have identical monozygotic twins, you will see one twin who has been a smoker who has aged tremendously faster compared to another identical twin who has not, who will look many years younger, just from the fact that he did not smoke and also the fact that he did not drink. So these three things, from alcohol consumption, sun exposure, and also smoking, these three preventative measures certainly will help the skin to look young and to have a youthful, aesthetically appealing, moisturized skin. Next, I want to talk to you about the nature of the skin, the scar. Scars are interesting. They can always be revised. It takes a scar up to a year to settle. So for the first couple of days, if the patient presents with a deep laceration, say for example a car accident, or the ear is disrupted, or a dog bite, we can revise as board certified plastic surgeons the scar such that we put it together such that the right respective layers align, where the skin is everted. When it basically matures, that the skin lays down very nicely and very smoothly. And then we can nurture and basically take care of this scar over the next 12 months. I always say technically it needs to be put together by a board certified plastic surgeon such that you give it the best shot and then you tame and manage the scar very nicely up to a year-long period. Next, there are other tools and modalities that can be undertaken that we have many tricks up our sleeves. For example, utilization of Integra, which is artificial skin, which is made up of cow collagen and shark cartilage. If these are extensive burns, for example, over large areas or keloid scars over large areas, we can certainly replace the skin with artificial skin or large wounds, full thickness. There are also roles for fractionated CO2 laser that will allow for a non-surgical management of wounds and scars that can allow for an aesthetically pleasing look. Scars can also be excised partially such that they do not have to be removed. Whatever bothers the patient can be dealt with such that we hide the scar and essentially provide minimal burden to an already insulted area. One of the other tools that we have is radiation therapy, which has been shown with up to 90% definitive certainty that the scar will not recur, especially in patients who are prone to forming keloids or hypertrophic scars, as you will see in my other videos. Depending on the nature of the presentation, I send my patients for radiation oncology treatment which is 3 consecutive days of radiation to follow surgical excision so as to allow for the best foot forward, if you will, and prevent a recurrence. Other modalities that we have are fat grafting, which allows for stem cells / PRP injections that will help the youthful cells within the body that will allow for rejuvenation and internal enhancement and allow for a scar to mature in a very positive and healthy way with good natural, the body's its own stem cells to nurture a wound. This has been very promising, especially on scars from car accidents or bad road rashes that are full thickness in nature. Again, I hope you find this video to be very helpful. Each one of us has a scar. There is a lot that can be done. I always say we have to respect the scar, respect the injury. A scar is the body's own way, as I mentioned earlier, to heal. It is genetically predisposed and also dependent on the nature of the trauma. There is a lot we can do in order to manage a scar that one may find very aesthetically unpleasing, so as to allow for it to hide in a very smart and selective way using the many tools and techniques we as board certified surgeons have. Thank you again very much. Please ask me any questions and I'll be more than happy to respond. Dr. Khan from executiveplasticsurgeon.com. Thank you.